we've heard a lot today about the connections between housing and health outcomes. And tell me your particular interest in this, Brandon.
Well, I've been looking at research, particularly examining HIV and housing as how they affect people that inject drugs.
Right. And tell me, I was interested to hear some of the connections you made between housing and homelessness. Tell me, you referred to homelessness quite a bit. Can you tell me how you define homelessness? Because there must be variations in terms of what we mean by homelessness. How did you take that?
That's one of the challenges of conducting this research, is that there's lots of definitions that we're dealing with. But we look at homelessness as absolutely living on the street, or transiently, perhaps even for a short term, without a fixed address. Unstable housing, or equivocally housed, is living in a shelter, or for youth, for example, couch surfing, something that is not particularly stable, but you're not necessarily spending a lot of time actually on the street.
Okay. About what we've heard more, there certainly seems to have been more concentration and agreement on the relationship between housing and health outcomes. And how have you found that panned out in terms of people who use injection drug units? Did stable housing impact health outcomes as you saw it?
Undoubtedly, that's one thing that we found was very clear, is that housing tends to improve dramatically HIV-specific health outcomes and general health outcomes for people that inject drugs, particularly when we're looking at things like adherence to HIV medication. Housing and stable housing is particularly important.
Okay. And so you found that there's better adherence with that was associated with better housing?
Yes. In a recent study we did that was published just a couple months ago, we found that individuals who were homeless were 40% less likely to adhere to their HIV medications over a long study period.
Now that's interesting. Why do you think that is? Why do people have better adherence when they have better housing? What's the connection, do you think?
We need more research to look at exactly why, but there's several possible explanations. Many are obvious. You know, if you're homeless or even unstably housed, it's difficult to access food and water. Privacy is also a concern. A place to store your medications can be hard to come by. And just the stigma and discrimination of living on the street and trying to take these medications can be very difficult.
Good. Now, Brandon, you said something today which was a sort of new thought to me, and you connected. You described housing, good housing, as harm reduction, and I've never quite heard it referred to in those terms. Now, tell me why housing equates to harm reduction.
We've shown clearly that housing can reduce behaviors that put drug users at risk for HIV. So by getting them into housing, we can, even if their substance use is ongoing, we can reduce the likelihood that they'll get HIV by providing these sorts of supports. So in that manner, it really is one of many harm reduction strategies that we can look at.
Brandon, you've given us a really good overview of the connection between housing and drug use and good outcomes, and thank you for doing that, and thank you for coming to New Orleans. Have you had a good time here?
I've had a wonderful time.
Good. Me too. From Positive Lite, Bob Leahy, that's it. Thank you.